Hello, Mr. Smith. It's Dr. Townsend.
Hi.
I received your lab work, and I'm concerned because your A1C value is 8.8%. That's quite a bit higher than last time. As I mentioned the other day, with the prescriptions you have, they should keep your A1C down in the area you decided to aim for. Can you think of any reasons why your A1C has gone up so much?
Mr. Smith and his primary care provider discuss his recent diet, exercise, stress, and alcohol consumption. During this discussion, it becomes more clear that the increased A1C may be due to medication management.
Okay. It sounds like we agree that your A1C may be going up because of some issues you have with your medications. Would you be willing to meet with Dr. Olson? She's the clinical pharmacist on your patient-aligned care team.
Yeah, sure, Doc. As I mentioned during my last appointment, I've been busy and I've neglected some things with my diabetes.
I understand. We can help arrange an appointment for you with Dr. Olson.
Thanks.
Good.
Hello, Mr. Smith.
Hi.
I'm Dr. Olson, the clinical pharmacy specialist on your patient-aligned care team.
Okay.
Now, I know your provider sent you to see me, so how can I help you?
Well, she wanted me to visit with you to see if there's a way to keep me from having problems with my diabetes. I imagine she thinks my sugar is too high, and I have been following my diet and exercising, though.
I see your A1C is 8.8%, and that means you are below the VA guideline for controlling glucose. But maybe there are ways to reduce your risk of future complications. I see you have prescriptions for, let's see here, metformin, lisinopril, simvastatin, metoprolol, glipizide, and aspirin. That sounds like a good regimen. When do you take your medications?
Well...
You know, it doesn't look like you have requested a refill of these meds in over 6 months. Are you getting these from a different pharmacy?
Look, you're probably going to be mad at me, but I have to tell you that I have not been taking the meds very often.
Oh, I'm certainly not mad. I am more concerned. Lots of patients stop taking medications. You know, you don't have to take the meds for my sake or to make us happy. The meds are for your sake. Can you tell me what gets in the way of taking your medications?
I suppose it's a combination of a lot of things. You know, I'm busy, I keep putting off getting refills, the co-pays do add up, and sometimes I just think that I'm feeling okay now, so why take the extra time for meds? What's really in it for me?
Well, veterans with diabetes should be aware that there are 2 major problems resulting from diabetes. One of those is vascular disease, and controlling your blood pressure and taking a statin are key factors in reducing the risk of this. Lisinopril, simvastatin, metoprolol, and aspirin, they all come into play here. The second issue is controlling the sugar, and your A1C, well, it is 8.8%.
What do I gain by getting my A1C lower?
That's a good question. I would suggest that since you already have the complications of diabetes, that we do not suggest very strict glucose control, like, say, an A1C of 7%. We can get you on metformin and shoot for an A1C of about 8%. Then we can see if additional medications are needed. This would give you a modest decrease in the risk of eye, kidney, and nerve complications over a 10-year period. So what A1C goal would you like to pursue?